thank you.
That's good. So we meet again. So we spoke just a couple of weeks ago in regards to starting a cardio course for you, so an endurance program for you. So we did a pre-screening and we did notice that you had 2 wrists, so we did have to refer you to a doctor just to get approval to do exercise. So we just came back, we've got a letter from your doctor, which is Dr. Albert Stevens. So he's just written us to say that you did have a right knee construction last year. You've completed 12 months rehabilitation, so that's all good. He has asked us to put some extra things into your program, so which we have designed it around that, so it's not actually hurting your knees or anything like that. So we're just going to maintain post-rehab ROM through the hips and knees. So just because you have had your right knee reconstruction, we're just trying to make it easier for you.
Yep.
So we've just included the gluteus raise and to do some squats. So he's given us the okay. So if you're happy to go ahead, we'll get started.
Yep, let's get started.
Yep. So I noticed that when we were doing it, you're happy to exercise 4 days a week, so Monday, Tuesday, Wednesday, Friday. Your goals are to try and lose weight, make it enjoyable, everything like that. So let's get started. So if you want to hop onto the bike, so we'll just do a warm-up phase for you. So the whole purpose of doing the warm-up phase is we're going to do it for 10 minutes. So what we're trying to do is get your heart rate. It usually sits around 40% on a normal average. So we just need to increase that up to 70%.
Yep.
And then that way it's pre-positioning your body to doing exercise and it's not putting it into shock mode as per se. So you can easily do a bike, you can go for a walk or run, as I know you do like to walk and run. So you can just do that before you start your exercises. Do a little walk around the block.
Yep.
How's that feeling? Good?
Yep, starting to warm up.
Starting to feel the heart rate come up?
Yep.
Yep. So you just do that for about 10 minutes. As I said, different things. You can do it on a bike, cross trainer, go for a walk, vice versa. Okay, so we've just done your warm-up, that's that part. So we've got your heart rate up now to 70%. So what I'll get you to do is just jump off that and we'll get into your first exercise. So what we're going to do is your wall push-up. So what that's going to be, that one there. So we're just going to do a wall push-up. So it's exactly the same as doing a normal push-up, but it's not as hard on your body. So it's just going to be using a wall. So what we're going to do there is 2 sets of 15 reps with a total of 60 seconds of rest time. So this is going to work your pectorals, your majors, your deltoids and your triceps. So I'll just demonstrate first and then I'll let you have a go. So what we're going to do is just stand pretty close, shoulder width apart. You're just going to put your hands pretty much not dead centre. So we're just going to go out a little bit, level, and then we're just going to drop your body and then go back out. So keeping your elbows in, making sure we have soft elbows, and then just going down and then back up. As I said, you can intensify, you can go out further and then back up. So if you want to have a go,
Yep.
see how you feel, if there's any problems, if it's not hurting that knee or anything like that. So just drop in. Yep. Coming straight back. Yeah, that's not too much pressure on the elbows or anything like that.
No, it's good.
Feels good? Yep. Excellent. Okay, so we know that one. So next one we're going to do now is your resistance band row. So what that's going to do is your middle trapeze, your rhomboids, your deltoids and your biceps. So we've just done most of them doing your wall push-up. We're just doing the opposite ones now. So I'll just get you a jump. I'll just demonstrate. So you can get different intensities of these. We'll just use this bike, so if you do have one. So just put it around there. Just slowly go down. Put your feet up there for resistance. And then just wrap around to your intensity. And then what you want to do is just lean back a little bit, pull your shoulders in. And then all we're going to do is pull back. And then just release. So once again, you can tighten. And then just pull back. So you're just pulling on a rowing machine is pretty much what we're going to do. So pulling back and then straight back up again. So I'll get you to have a go, see how you feel. So just go onto them. So feet up. So just lean back a little bit, pull in your shoulders, yep, and then just pull down towards you. So just trying to pull straight back, so you're pulling in your shoulders. Can you feel it pinching in the back shoulders?
Yep.
Yep. So just keep going. So like I said, keep twisting once you get to that resistance of can't upgrade on bands. Yep. Excellent. Okay, so you got the feel of that. That didn't hurt too much. It was pretty good.
Good.
Cool. Take that off. Okay. So the next one we're going to do is your partial range squats. So this is up to you. So you do know that you have a sore knee. So we're just going to ease into that one. So what that's going to do is just pretty much work your gluteus, your quads and your hamstrings and biceps. So what you want to do is have your feet shoulder width apart, so just out.
Yep.
And then what we're going to do is, depending how you feel comfortable with balancing, we're just going to drop and we're just going to go partial way. You can, if you do feel comfortable, go all the way down, like you're sitting down, but that might be a bit much on your knee. So what we're going to do is keep your knees tracking with your toes, soft knees, and then we're going to push through with your heels. So if you want to have a go, so just drop down a little bit, go halfway. Yep. That's all right on the knee, Di?
Yep, that's
Yep.
okay. No.
So just have a few practices. So we're just going up and then down. Very good. Like I said, over time when your knee does strengthen up, you can go all the way down
Go a lot
to doing a
lower.
full strength squat. Okay, so the next one we're going to do now is a glute raise. So as Dr. Stephen said, we want to try and work your hip muscles and your knee. So your glute raise will help with that. So it's strengthening your gluteus maximus. So I'll just show you how to do one. So we're just going to lay down here. So
Yep.
just put your knees there. So just have your arms there, and what you're going to do is just raise your body. So you're just going to be doing that. Hold for a couple of seconds, and then back down again. So that's just tightening your gluteus. So back up, and then back down. So that will tighten those muscles. Yeah, so I'll get you to have a go, see if that's
Yep.
alright and it's not hurting your back or anything like that. So arms down, and then just raise your bum up. Yep. And then put back down. So just hold it for a couple of seconds and then just drop it back down. Yep. So once again, these will be 2 sets of 15. And then as time goes, we can increase these. How's that? That's not hurting your shoulders or anything?
No.
Yep. Very good. Okay, so if you want to hop up. So the next one we're going to do is just a single leg calf raise. So that's just going to be working your soleus and your gastrocnemius. So you can for balance if you like. So what we're going to do is just stand straight. You can put one foot, hold one foot, or put it behind you, however you feel comfortable. All we're doing is just raising to our tippy toes, holding it for a couple of seconds, and then back down again. So you can hold onto here for balance. So what we're going to do is just go up, hold, and back down, and then swap legs. So go up, tippy toes, and then back down. So I'll let you have a go, so just hold on to that for balance for yourself. So onto one foot, and then raise yourself up, and then back down. Can you feel that tightening in your
Yep.
calf muscle?
Up and
Yep.
back.
Yep, so just one more. Yep. And back down. And just swap legs. Up. Up, balance. And down. Couple more. Excellent. Okay. So that's the lucky. We've got one more, which is the plank. So pretty much we're just holding ourselves in a plank. So what we're going to do there is work our trapezius abdominis. So what we're going to do is just go down. So there's 2 options you can do. So you can do on your legs, or you can go down to your knees, but being that you do have a knee reconstruction might hurt a little bit. So what you're going to do is have your arms straight underneath yourself. So you can hold it like that, having a straight back, straight as you can, going down, and then we're just going to hold it. You can go up a level, so you can go on your toes, and then that's just tightening your abdominal, and then we'll just hold that for a little bit. So as maybe just try on your feet and see how we go with that one. So straight under, up onto your toes, just put your bum down, and then hold that. And how's that going on the knees? It's alright?
Yeah, no, that's all right.
Can you feel it tightening just in here?
Yep.
Yep. So once again, we just hold that for 60 seconds and then just drop down, have a couple of rests, and then just have a little another go just to make sure it feels comfortable. Excellent. Okay, so that's pretty much your program, so I'll just get you to hop back on the bike. So we're just going to do a walk down phase. So we got your heart rate up, so we're trying to get that back down to 40%. So we're going from 70 heart rate back down to 40%. So this just slowly cools down the body, lets your blood circulate, stops it from cooling, and then getting tight muscles in the end. So we did 10 minutes of a warm up, we're going to do 10 minutes of a warm down. As I said, you can do this on a stationary bike, a stepper, a cross trainer, vice versa. So, I'll just ask you a few questions while you're warming down. How did we go with your endurance program? Were the exercises okay with your knees and your hips and everything? Wasn't too strenuous?
No, I think that'll suit my knee and my problems down to the ground. I think I'll give them a go.
So it was working all the muscles that you want it to, and it suits your goals and everything like that?
Yeah, hopefully for now that'll be really good.
And you're happy to keep going ahead with the program and everything like that?
Yep, will do.
Yep. So now we've got your heart rate down, we will do a few stretches just to stretch a few things out. But in the meantime, so we're going to do this 2 days a week. In between them, we will do some cardio stuff. So we can do like a walking session around the block. As you said, you do like walking and jogging. So just to do our cardio side. So we're doing the endurance, we just got to do a cardio as well. So just in between those few days. But so I'll get you to hop off that, and we'll just do a few stretches at the same time. So just because we've done all those exercises. So the first one we'll do is your chest exercise. So just get your legs just a little bit apart. So what we're going to do is just stretch your muscles. So if we just want to bend down a little bit, just relax. And that side. And then what we're going to do is just bend one knee. And then that will stretch on the inside of your legs. And then hold that for a little bit. And then we want to go back up. Okay, go back out. So we've done all the arms, so we just want to stretch them. So if you just grab one arm, push it over to the side, so it's going to stretch all on the side there. Thumb down and just pulling it so you can feel that stretch just there. Thumb down. So we hold that for a little bit. And then you shake. Other side. Shake that one out. Okay, so we've done our arms, our trapeze and biceps. So we just grab one arm, elbow over, stretch that one in there. Okay, out, top side. Okay, take that one. We just got to do our back, so just upper side again. Hold that. And all done. That's our course, so that's our endurance program thing, and so hopefully that's everything. We will see you in a couple of days. We will look at this in another 6 to 8 weeks, see if there's anything that we need to increase or change depending on how you're feeling. Other than that, we're all good to go.
Yep, thanks
very much. I don't think I did the